Good day, ladies and gentlemen. My name is Sharina, editor for Medical Channel Asia, and today we are joined by Dr. Loh Jiashen, Infectious Disease Specialist from Starmed Specialist Centre Singapore. Dr. Loh, last week during the press conference of the World Health Organization, they have finally announced the end of COVID-19 pandemic being a World Health emergency. Now, what are your thoughts on this announcement as an infectious disease specialist?
And the declaration of the end of COVID-19 as a global pandemic is very timely. It's very timely because the case rates have stabilized, death rates have dropped, the vaccination rates have increased and generally provided a very effective barrier against morbidity and mortality from this virus. And we've battled it for 3 years, and there's a lot of scientific knowledge. And healthcare resources and abilities have also stepped up all across the world. So I think it is quite timely. And I also think that going ahead, the things to do, the efforts incumbent on healthcare sectors are also more rigorous now, because now, as we transit to living with COVID, we must understand that this is a new pathogen that will be with us for a long, long time, and we will never be able to wipe it off. As it enters the community, it becomes endemic. It also means that we must maintain our vigilance and must not lose the knowledge and ability that we have gained so far. And yet, this pandemic has taught us many valuable lessons. Whether we can remain vigilant for the next pandemic, for the next emerging virus, and not be caught off guard, that is a real challenge.
And for me, as part of the public or as part of the community, I was quite shocked with the announcement, or because I still have my guard up when it comes to the pandemic. But how do you think the public should react to this? Should they feel safe with their assurance that you already said? What should they be reacting towards this announcement?
Well, I think the clear-cut answer is maybe they should react with relief and happiness, because this is really a much better time than 2 years ago, when we are struggling with peak death rates and hospital being filled and ventilators running out of supply. I think we have definitely come a long way. So so first thing is definitely some sense of reassurance. There's no real need to panic about this, because as we understand, most people are vaccinated, at least in Singapore. In Asia, the rates may be lagging behind a bit, but there's no longer a limitation in supply for effective therapeutic drugs. So I don't think there needs to be too much concern or worry. Doesn't mean that we are letting down our guard.
And finally, I wanted to ask, especially on behalf of those Asian countries that may have less resources or does not have the same precautionary measures as other countries are doing in terms of COVID-19, what are the precautions that we should continue as an individual or as a country to take with regards to COVID-19?
As you understand, the human race as a whole has been progressing steadily against infections and against pathogens over the last decades or maybe even centuries. With every vaccine, every new antibiotic, every new treatment, pathogens and germs and bacteria have lost more and more ground. This is one where they have gained ground and they're not going to lose that ground. They have added themselves. So we have, as a species, probably taken a step backward in, I suppose, allowing another pathogen to enter the mix. But we have taken many steps to mitigate it, many steps to control it. So what can the individual do? Actually, it's the same as what the individual can do to prevent morbidity and mortality from all previous infections. It means the individual can maintain themselves at the peak of health, control their chronic diseases well, control their lifestyles well. It is a respiratory virus. Coronavirus is a respiratory virus. It affects the lungs in severe cases predominantly. So people can take good lifestyle decisions, for example, to stop smoking, to keep obesity at bay, to maintain within a healthy weight range. These are things everybody can do, and it can has good effects against COVID and any other diseases or illnesses. For those who are not yet vaccinated for COVID, please go and get vaccinated. The vaccine is safe and is effective.